afternoon, classmate. My name is Eric Shakor. I'm second year student at Brokenshire College. And for today's RD, this is the project of NCM 109. And today I'm going to make a RD about the new nursing care management for newborn. And so what is newborn care? Newborn care is a nursing care management which management for neonate which is the transition for the extra uterine life. And that's it, guys. And I hope you enjoy it, guys, and watch the video. And we're gonna start now the first procedure on how to make a newborn care. Since the first thing that you will do in doing the nursing care management for newborn care, we need to assess first the mother. First thing that you will do is to observe the mother. And then the second thing you do is to inspect. And then third is auscultation, and fourth is the palpation. And after inspecting all of that, you need to do is to check the airway. The airway so that the mother can breathe well. And then the lastly is to check the body response system. Check the body system. And that's the first thing that you will do in newborn care management. Hi guys, since we are done with our assessments, it's now time for us to do the planning. So what to do in the planning? First thing that you will do is to wash your hands, gather the equipments. Equipments are for sure the dress of the baby, shoes, also cord clamp, and then always maintain a thermal environment. Maybe checking the aircon if you have an aircon, make it not cold. And then lastly is to check the identification. Check the identification of the mother if he or she is the patient of for our doing a newborn care. That's it. This is the planning procedure on the newborn care management. Hi guys, since this is the third procedure in the newborn care system, we assume that we get now the baby. Yeah. First thing that I will do is we assume that the baby is out already and we're done doing the nursing care management. All you need to do is to call up time of birth, what time does the baby go out in the mother's womb. And then third is dry the newborn baby thoroughly. For drying the baby, use always a clean cloth because this is so sensitive for the baby. We need to maintain sterility or cleanliness for the baby to be safe. And first is wipe the eyes, face, back, and front of the baby. And then remove the wet cloth. We assume that we will remove it. And then do while doing the certain things, uh, uh, check the baby's breathing, respiration. And that's the first implementation for newborn baby. Hi guys, after we are done with our drying our baby, newborn baby, all you need to do for 30 minutes, all you need to do is to place the baby on the chest of the mother. And then after uh, putting it on the chest of the mother, we need to cover the baby. And then assuming we will put a bonnet on her. And then fourth step is to put the identification. This is the identification. It is important for the parents to know the name of the baby and identification, so that we cannot lose the baby's name, or lost the baby's name. Put it on the ankle. And then after that is to do not separate the baby crying and breathing to the mother. And that's the second step on newborn care implementation for baby. Then after doing the second procedure of the baby, all you need to do is to do the third step. This is the cord clamping. Cord clamping, this is the cord of the baby. All you need to do is to make remove your gloves, the first glove that you have. And then third step is to put a cord clamp. Here we assume that, for example, here cord clamp, and for the wait for the pull cord clamp for 5 centimeters. And then after that, we can now cut the clamp, the cord of the baby. And observe nosing blood. And that's the third step of the cord clamping. For the fourth step of the newborn screening for mother, all you need to do is to provide a initiation for breastfeeding. This is to provide a breastfeed for the baby newborn. First thing that I will do is to initiate a newborn a breastfeeding position. And then initiation, and always provide a skin-to-skin contact to the mother and close to the mother, and assist the baby breastfeeding to the mother. That's the fourth step of the newborn care management. And then after doing the breastfeeding procedure, all you need to do is to provide a vitamin K for the baby. Do it in the vitamin K 1 mg, and always remember that the future of the baby is in yours. Whatever the procedure may affect the baby's future. Always be on the on the be always conscious on doing what the procedure that you have do. We assume that this is the injection. All you need to do is to this is the vitamin K. Do it in the vastus lateralis of the baby. And then second is the vitamin hepatitis B vaccine intramuscular. And then check the malformalities or injuries of the baby. If has malformation, abnormalities of the babies, always check that. And then third, the feeding difficulties. And then lastly is to make the baby always in the warm exposing radiant warmer. And that's the fifth step of the nursing care management for baby. For the sixth step of the newborn care management implementation, all you need to do is this is the procedure of the stamping of the baby. So where is the stamp of the baby? This is the sensitive part of the baby, because this is the fresh flesh cord of the baby, and avoid touching on it unnecessarily to avoid infection. And then put a diaper on it. And then if the stamp of the baby, this one, is solved, you can wash on it and hygiene on it the baby for maintain sterility and cleanliness. And that's the sixth step of the newborn screening. And then for lastly, this is the procedure of the newborn screening of the baby. All you need to do is to this is the procedure of washing and bathing. So 90 minutes age of prior, 90 minutes, it means the 90 minutes age has passing already. Discharge, and make sure that the room is warm. Make sure that the room is warm. And then use warm water for the baby. And then use the infant's head in the circular motion, tilt head back. This is the washing and bathing of the baby. And then torso, extremities, wash it, bath the buttocks. And then lastly is to dry the baby. And you can now dress up the baby after bathing on it. We assume that we wash and bath the baby and dry on it, and we're done. Put the clothes on it. And we may now put the baby in the incubator for the baby to to have a warmer to for the baby to be safe. We dress on it. Dress on it. And this is the lastly part of the newborn screening of the baby, and the washing and bathing, and we can now put it in the incubator. But yeah, that's it, guys. And for the lastly part of the procedure in newborn screening, all you need to do is to evaluate the baby, evaluate on it, and then correct identification. It is being said that always put on the ankle of the baby. And then third is to document all the procedure, evaluate, and that's it, guys. I'm finished with my newborn screening. I hope you learn on it and enjoy how I do mine. I hope you learn on it and have a learning experience with me. And that's it, guys. Thank you for watching, and this is the project in NCM 109, and thank you for all. And that's the end of my video. Thank you, guys. Bye. And lastly, for the part of the newborn screening, all you need to do is to inform the parents or the guardians of the mother to provide a cloth for the baby, because it is implemented that for the mother for giving birth, the parents should be prepared on giving the clothes and prepared giving the clothes of the mother. And that's it, guys. Thank you for watching, and I hope you enjoy on it and learn my newborn screening management. Bye, guys. Thank you.